Hello, today I'll be demonstrating CPR. CPR, the acronym CPR in full is Cardiopulmonary Resuscitation. Now what is CPR? CPR is the help given to someone in an emergency or someone who is unconscious. And it is normally the first basic life support they get. Now before doing CPR, there are few things that you need to consider. There are few other steps, and those steps are put in order as DRABC or Dr. ABC. In this demonstration, I will do CPR for an infant. An infant is someone who is from age range newborn to 1 year old, or 0 months to 1 year of age. So, the first thing you do upon approaching an infant, you check for signs of danger. If the infant is in danger, or if you are likely to be in danger when doing the CPR. So if there's fire, or if there's electrical hazard, or if the infant is drowning, you have to get the child out of the water, or get rid of the fire or the electrical hazard which is posing the infant or the caregiver, which is you in this case, in danger. After doing that, the next thing you should do before any CPR is to happen is call for help. Call for professional personal help. Call 911 or 999 in some countries. And then you proceed on to the next step, which is R, the responsive test. Check for response of the infant. So you tickle the underside of the foot, and then you call the baby's name if you know the baby's name, or just simply call. Tickle while call. Baby, baby, baby. If the baby responds by crying, or if you feel any muscle contractions, then you simply lift the baby or the infant and put in recovery position for infants. And this is how you put an infant in a recovery position. So lift the infant should be lying like this with the head supported with your palm. Yeah. So the baby responded, you just put and wait for put to recovery and wait for professional help. However, if there is no response, you put to recover like this, but then you clear both the nose and the mouth. Clear both orifices, so you can get rid of the mucus from the nose and whatever is in the mouth, whatever is obstructing the mouth, just you have to clear it. After that, you put the infant on his or her back, and then you move on to the next step, which is breathing. Now, before you go to breathing, you check again before you go to breathing, you have to check the airway. So how you check the airway? You do the head tilt chin lift. So tilt the head like this and lift the chin like this. And this is to make the airway pattern, the pharynx pattern. So when you do this maneuver, the tongue is now clear from the airway. Okay, and then you look, listen, and feel for breathing. So you look for if any signs of breathing on the chest, and then you put your head closely to the mouth and the nose so that you can feel if the baby is breathing. So you look and you listen and you also feel for breathing. If the baby is not breathing, then you give 2 rescue breaths. Now those 2 rescue breaths should come from your mouth. They're not too hard because the baby is an infant. Eh? So you reposition the airway again, head tilt, chin lift, and then you give 2 breaths. 2 breaths. And after that, after giving those 2 breaths, you check for signs of circulation. Yeah. If you give the signs of breathing, if you give those 2 breaths, 2 bouts of breath, and the baby starts to breathe or there's any signs of circulation, then you simply put the baby to recover while wait for help. However, if you check the airway and you give those 2 breaths and there's still no signs of circulation. Now, how do we check for signs of circulation? Those signs of circulation you check for is you check the color of the skin, yeah, check the color of the skin, check the chest, yeah, because if the baby is breathing or if there's circulation, the baby will, you see the chest moving, and you see the color of the skin changes when you give those 2 breaths. So the baby, if the baby is kind of bluish, the baby will come back to normal skin color, yeah, a bit bright, yeah, and not cyanotic anymore. And also you can check for the pulse. Now you check for the pulse. For the pulse you check on the upper arm, the underside of the upper arm. You check for the underside of the upper arm for the pulse. Yeah, this is all signs of circulation. So check for movement, check for chest movement, color of the skin, and the pulse. Yeah, and for baby, for infant in particular, you check the underside of the upper arm. Now, if you check all these Dr. ABC and there's still no signs of life, then you move to CPR. Now, CPR is somewhat a bit different for infants. However, for all age categories, the standard 30 compressions, 2 breaths is across the table. But it's slightly different for those ages. Like for infants, you use your 2 fingers, the middle finger and the index finger. And then you compress at least 30% depth of the chest. So I'm going to demonstrate. So you give 30 compressions and 2 breaths. 1, 2, 3, 4, 5, 25, 26, 27, 28, 29, 30. Reposition the head again. Tilt the head, lift the chin. Give 2 breaths. Remember to always seal your mouth on the nose and the mouth. Seal your mouth on the nose and the mouth of the infant. Yeah? So you should form an air sealed interface, and then air should go in both nose and the mouth, and then you look for chest to, if the chest is rising, that means the airway is patent and the air is going in. So you give 2 breaths after the 30 compressions. 2 breaths. After those 2 breaths, continue with compression. After those 2 breaths, you check for signs of circulation again. Check if the baby, if the skin color changes and all these things. If it doesn't, then continue with the compressions and give 2 breaths. So 1, 2, 3, 4, 5, 25, 26, 27, 28, 29, 30. Head lift, head tilt, chin lift, and give 2 breaths. 2 breaths. So your mouth should be interface and air sealed with the mouth of the infant and the nose. And continue with this CPR until you see signs of life. If there's no signs of life, then you always continue with the CPR until professional help arrive. So I think this is for CPR for infant. I hope you learned something. Thank you.